Hello, this video is presented by the Children's Minnesota Rehab Pediatric Pelvic Health Program, and the topic of this video is constipation and encopresis. Now that you know how the gastrointestinal or bowel poo system works, today we're going to talk about constipation and encopresis. Encopresis is when poo leaks out of your body when you don't want it to. If we can better understand what is causing you to leak, then we can help to figure out how to help. Constipation is a common occurrence and can mean many different things. It may mean that poo is staying in your colon for too long. We know the longer the poo stays in the colon, the harder the poo becomes. And the harder the poo becomes, the harder the poo is to empty. This can lead to hard or painful poos and not pooping often. Believe it or not, constipation can still occur if a person is pooping every day. Usually it just means a person is not pooping enough every day. If constipation occurs day after day, week after week, poo will back up into the colon and the colon can become full of poo. Chronic constipation is often the main cause of encopresis or poo leaks.
Now let's talk about the cycle that often occurs leading up to encopresis. In order to do that, we have to review how our body should be emptying our poo. Here's a picture of our digestive system. We are going to talk about the last section of the digestive system, the colon and the rectum. Remember, poo is already poo when it enters the colon. It starts out as watery poo, and as it travels throughout the colon, water is taken out so that it turns into form poo by the time it is ready to be emptied. The very end of the colon is the rectum. This is where the poo passes through before emptying out of our body. The rectum functions like a balloon. When it fills with poo, it will stretch and get bigger, and then when it empties of poo, it will get smaller. The rectum is meant to be a sensory organ or a pass-through organ. It is not meant to be a storage organ. As the rectum fills with poo or gas enough to stretch, the rectum will have special nerves that know the difference, and it will then send a message to your brain to let you know if you need to pass gas or if you need to poop. When the system is working well, a person will get the message and then respond to empty the rectum, either by passing gas or by having a poo.
This system doesn't work as well for people who have constipation. A few things could be happening for these people. For example, a person may have so much poo in their colon that even after a poo, more poo will quickly enter the rectum and fill it again. A person may have such hard stools that it's difficult to get all the poop out, or a person may feel it's too uncomfortable to get the poop out, so they may avoid having a poo.
So any one of these situations can lead to the constipation encopresis cycle. The cycle usually starts with constipation, and then the rectum gets overfilled and gets used to having more poo in it. Then it will stop sending the message to the brain that it's time to empty, and a person may stop feeling the need to go poo. This leads to more poo filling and more stretching of the rectum. And this leads to poor emptying of the rectum. And if the cycle goes on long enough, it leads to poo leaks. If this cycle goes untreated, it will just continue on. When a person is having poo leaks, they can happen a few different ways. Number one, eventually the rectum will just get so full that it will have to empty without a warning, and you get a poo leak. Number two, the rectum will already just be so full of hard poo and watery stool from higher up in the colon that the watery poo can slide around the hard poo and leak out without a person even knowing. This is called bypass diarrhea. When leaks occur, they may be small or large. They may be firm, soft, or a watery type. Leaks may happen at any time without warning, and poo leaks can be upsetting and embarrassing. The important thing to know is that it's not the person's fault that they are having leaks, and there are many things that can help to stop the leaks.
If you're having poo leaks, your therapist will help to figure out the best plan to stop the leaks, and you and your family will have activities and exercises to complete as a part of the plan. You, your family, and your therapist are a team. The most important thing to address first is to work on addressing constipation. Your doctor, therapist, and family will work together to choose the best constipation management options for you. That may mean a person will start with a bowel clean out. This means a person will take medicine to empty all the poo out of the colon. This is usually a higher dose of medicine in a shorter amount of time. If we empty the rectum and the colon, it often allows for the next phase of treatment to work faster and better. The next phase to address constipation after a clean out is often figuring out the best medicines to take to allow for regular pooping every day. Our goal is to have a large, soft, easy to pass stool every day. If a person has a history of chronic constipation and stool leakage, their body will likely need some help from medications to learn to become more regular. Your doctor and your therapist will work together to help you figure out the best plan for you to reach your goals. And your doctor and therapist will be there to help you wean off your medications when appropriate.
Your rehab therapist will also help to teach you healthy bowel and bladder habits, create a toileting plan, work on techniques to teach your body how to recognize when you need to go and how to fully empty your bowel and bladder, and work on training your pelvic floor muscle system and your pressure system, including your back, belly, and breathing muscles. With steady routines and regular practice, your body will get used to going when it needs to so that you don't have leaks. You'll also feel more comfortable taking care of your plan on your own, and your therapist will be there to guide you and your family through any challenges along the way. Thank you for watching today, and remember, you and your therapist are a team, and it's important that you work together to meet your goals.